student nurses. In this video, we will be going over the blood flow through the heart. Before we get started, let's go through some orientation. So as you see right here, this is the right side and this is the left side because we are looking at the heart as if it were a patient and not ourselves. Down here, as always, is the apex of the heart, so that's towards the bottom of their body, and this is the base, so that's more towards the head. Now let's get into the blood flow of the body and of the heart. So we're going to start off with the blood that has already been through the body. It's all deoxygenated. It has dropped off all of its oxygen in the tissues of the body. So the blood is going to enter through the superior vena cava and the inferior vena cava. This blood will then go into the right atrium here, through the right atrium into the right ventricle. From the right ventricle, it's going to travel up into the pulmonary arteries. From the pulmonary arteries, it will go out to the lungs, as you see here. In the lungs, it's dropping off that CO2 or that carbon dioxide, and we breathe that out. And then as we breathe in fresh air, our blood picks up that oxygen. And now that we have oxygenated blood, it's going to travel back through the pulmonary veins here and here. And it is going to go to this left atrium here. It's then going to travel into the left ventricle and then up into the aorta. From the aorta, it's going to go to the rest of the body, as we see here. These ones up here go up to the head neck areas, and then as you see down here, the aorta continues and it goes to the rest of the body. It is important to note that the atria, both of the atriums, will contract at the same time, and then shortly after, both of the ventricles will contract at the same time. The heart contracts rhythmically, so it's lub-dub, lub-dub. The lub noise you hear, or S1, is both of the atrioventricular valves closing. The dub sound is the semilunar valves closing. So as both of the atriums contract at the same time, blood flows through these valves here, and then the ventricles will contract at the same time, and at the same time, the left ventricle blood will go into the aorta, and the right ventricle blood will go into this pulmonary artery here. I have listed down here all of the anatomy the blood goes through in order, starting with the inferior and superior vena cava and ending when it goes through the aorta to the body. There are electrical signals that pulse through the heart, and there are nerves in here that carry those electrical signals that we can go over in a later video. Thank you for watching. I'll see you next time.